Good afternoon, and welcome to the Flint Community Webinar Coronavirus, providing a local context to this global pandemic. We want to thank you for joining us today for this week, July 8th, 121 weeks of trusted, credible messengers with and these dependable partnerships. This webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Again, we want to thank you for joining us today. And I'm your moderator, Yvonne Lewis, and I look forward to having you in this conversation today, very important conversation to talk about the information that will make a difference for us in our communities. Today, we have very exciting topics that we're going to cover. COVID information portal is one that we're going to be addressing today. We're going to be talking about vaccines and boosters through our medical moment. And we also have some updates from some data and City of Flint news and updates from the Genesee County Health Department. So we look forward to having this great conversation with you today. Today, we are wanting to appreciate all of our partners who joined us for these weeks, a variety of community organizations and agencies. The Health Department is here today to answer questions for you. We also have representatives from the University of Michigan, from the Genesee Health Plan, and a number of our other partners who are here to help respond to any other questions that you might have. So we're going to ask you today to make sure you put your questions in the queue, and we will do our best to make sure we get those questions answered for you. We want to remind you that this month is National Minority Mental Health Awareness Month. And so for those of you that are concerned about mental health awareness, we do have a number of resources available in our community, and we'll continue to reiterate those as we move forward. We have a special opportunity for you today. We are looking for some of our speakers today to be in the roundtable with us. We actually have some exciting updates for you for our roundtable today. But our topic speakers today, we will have Athena McKay, who's going to bring us information. We have our medical moment. We do have some adjustments to our team today, and we're going to let you know we have a special guest with us, Dr. Jennifer Edwards-Johnson is also going to join us today. And so I'm going to ask her to first come up and join me in the roundtable for today for our roundtable discussion. Dr. Jennifer Edwards-Johnson, we thank you so much for joining us today. We've got some questions for you. And I do see Dr. Lawrence Reynolds has joined us. We're going to ask him to join us in the roundtable as well. Dr. Reynolds, there you go. I see you, Dr. Reynolds. Thank you for joining us today in the roundtable. We've had some questions, and one of the things that we wanted to do is to make sure that, there you go, Doc. We want to make sure that we're able to answer some really big questions in the roundtable for our community. We may not have all the answers, but I know our experts here will give us some good insights. And one of the questions that has come forward, and we talked about this some time ago, about herd immunity. And so one of the questions that was asked is, we're getting the vaccines, we're getting people who have had the virus. If you have had the virus, does that give you full immunity from COVID? And I see the smile on Dr. Reynolds' face, and he has opened up his mic already.
Come on, let's have this. Defer to my grown-up medicine specialist, and I'll follow.
No, that's what the answer is, no. And we've got to follow that with some explanation, right? Because we've heard different pieces of this. We understand that our immune systems do a really good job when we get a virus of responding and creating some immunity for us. In the case of COVID-19, early on, we were seeing that in some variants, we were getting a little bit of immunity, right? We were getting some natural protection for a little period of time after we were infected. And increasingly with each variant, we've seen that natural immunity that's been a response to having COVID decline. So our immune system is not doing as great of a job of creating that sort of natural immunity response after having COVID. And it's sort of unfair to blame the immune system only, right? COVID-19, the virus, has mutated, and we've had different variants that have done a better job of escaping our immune system. So the virus is hiding, basically, has done a good job of sort of mutating so that it can stay away from your immune system. And we've seen that happen with each variant. And we know that particularly with the variants that are really prevalent right now, those are the BA4 and the BA5 variants, that they're really, really good at escaping our immune system. And so we don't see that sort of little phase of protection that we once had. And even more, I've seen patients get infected with COVID and as soon as 5 or 6 weeks later, get a reinfection.
Well, there's not a whole lot I can add to that very succinct summary, but I'll give you my usual response. And that is why we must have layers of protection. If you feel sick, get tested. If you've been in an unmasked crowd, get tested, and avoid contact with people you know who are immune compromised, immune suppressed, or who have had an organ transplant. And also consider avoiding children until you get tested and you know what your status is, especially if you're symptomatic. And there's nothing against the law that says you cannot wear a mask. So if you're going out in public and you're in a situation where you don't know people, put on your mask. If you invite people to your house, tell them, if you're sick, stay home. If you've been in contact with someone, at least put on a mask before you come to my house or get in my car. And avoid crowds. And you've heard me say so many times, there are things I do, like I test before I go see my 93-year-old mother. I usually will avoid crowds the day before, just so that I don't pick up something to take to her. And the same thing for travel, because this is travel season.
Yes.
So everything is a layer of protection, and so is vaccination, so is Paxilvid. But these are, you remember the Swiss cheese package. There are holes in each layer of the cheese for different reasons, but the more layers of protection you have, the less risk you have of getting infected.
Now, Dr. Reynolds, you mentioned a term that Paxilvid. That is, tell us what that is, please.
Oh, that's an antiviral medication. It's actually a combination of 2 medications. And if I tried to pronounce the names of all these antivirals, I'd get tongue-tied. But it's important that if you test positive, within 5 days of symptoms or testing positive, you contact your physician, and now they're saying, or your pharmacist, and get a prescription for Paxilvid. And some places test and treat at the same site. Now, these things are developing and on their way, so it may not be available in many places till next week. And pharmacists do not have to prescribe or test and treat. They actually have to voluntarily decide to participate. But the key is know who your provider is, so that if you go to an emergency room or somewhere and you test positive, if they don't give you a prescription, call your doctor, and you've got to do it within 5 days before it's totally effective. And it doesn't mean you go out and party after you take those pills. And Dr. Edwards Johnson.
So Dr. EJ, yes.
I couldn't agree more. I would say, we say within 5 days, but as soon as you develop symptoms, I don't care if it's a sore throat, whatever it is, getting in contact with your primary care physician is really important, because it allows you to make the decision about Paxilvid. It allows you to get sort of treatment as soon as possible. So that means you're sort of starting your clock as soon as possible for that 5-day duration that we talked about. When we talk about Paxilvid, it's most effective the earliest you use it, right? So as soon as you develop symptoms, getting in, talking to your doctor, do I need Paxilvid? Would this be something that's going to be helpful for me? And trying to get that started so that you reduce your symptoms and you know, are within that 5-day window as soon as possible.
So Dr. EJ, right there are some people who have said to me, I didn't have any symptoms. I went to get a test just because that's something I've routinely done now as a part of my week or monthly activities, but I didn't have any symptoms. So
yeah, so if you tested positive and you were just doing your due diligence, like Dr. Reynolds mentioned, right? You were going to see someone that you love and you were just testing. I still think it's a good idea to talk to your doctor. You don't know when you might develop symptoms in the process, right? There are people who test and then develop symptoms 2 days later. So it's certainly important for you to talk to your doctor. It's also important because I can't tell you what the risk is going to be for each person, right? There are people who might have underlying conditions, who might need to be more thoughtful about getting in with their doctor and considering treatment. You might be going out of town and your doctor might say you have to have Paxilvid on you because in case you get symptoms or in case you get sick, I want to make sure you have it with you. So as Dr. Reynolds alluded to, that you don't have to look for it. You don't have to, try to find a pharmacy that's going to write it for you. So I can't underscore enough the importance of having that conversation with your doctor so you know what to expect and what your next steps should be.
So we want to just make sure everybody in our community has access to healthcare and gets that primary care physician, as you so often talk about. Just one last question that came up as we're talking about the outbreaks and all of those things. Want to just ask you, fewer outbreaks, which means there's declining numbers of cases. How do you explain that we're still in a pandemic?
It's interesting that you say fewer outbreaks because I feel like that data changes weekly. And I don't mean that jokingly. It really does change weekly. And it changes for several reasons. One, we have access to home testing, which is great, right? And so oftentimes people the way data is collected, they may not be collecting the people who are home testing, right? I take a home test just like Dr. Reynolds does at home, before I go see my loved ones. If that were to be positive, it might not be counted in the number of positive cases depending on where I enter the medical system. Two, we always have to remember that cases often lag, right? And they're often sort of one of the last indicators. We just had a holiday weekend where lots of people were gathered, lots of people were having a lot of fun with their families. I wouldn't be surprised if as we enter the weekend, we start to see an uptick in cases, and in different places around the state, you can see that. You asked a really important question that is like, what do we do about this pandemic? Like, what does this mean, right? And I think we get back to the fundamental definition of a pandemic, which means you have a widespread disease globally that has increasing cases, that has case surges, right? We're still in a space where we have surges, right? We just had a surge a few weeks ago. We have different variants that have been causing surges. And until we get to a space where we're in sort of an equilibrium, where we're not seeing these crazy spikes in cases, we're not seeing case rates of over 100,000 a day, et cetera, we'll be in a pandemic that we have to figure out, based on our trusted messengers, how we navigate the world safely. And I think Dr. Reynolds alluded to some really important methods that we can navigate the world. There's multiple layers of protection. We vaccinate and get vaccinated and are getting our boosters. We wear masks and quality masks. If you have access to N95 masks or KN95 masks, those are great masks to wear and protecting yourself. And we try to keep our activities outdoors where there's good air circulation, right? We're thoughtful about our environments and the air quality and the air circulation in our environments. And I think those multiple layers of protection are how we kind of continue to move ourselves forward. Lastly, we test, right? We're responsible about who we're going to interact with and when. And we're thoughtful not only about our own health, but the health of the people that we interact with, which means testing before you go see your 92-year-old mother. And I test every week before I go see my mom, and she would kill me if I said she was 92. So my very young mom, who I take to see her grandchildren, I test before I see them. So I appreciate those layers of protection.
Yeah. So you gave us a couple clarifiers, Dr. EJ. You said surge versus outbreak. And so sometimes because we don't hear all of this in the popular news as we did before, it sort of gives us a sense that maybe it isn't, maybe it is over, or well, how do we think about it? So Dr. Reynolds, I'm gonna give you the last word on this. In terms of this need to ensure that we are paying attention to where we are right now as a community.
Well, first of all, remember, as Dr. Edward Johnson said, we are in a pandemic, and it's not like a seasonal cold, a seasonal illness. So we have to always think about what we do. And if we don't think, if we don't listen to credible messengers, and that can be your doctor, it can be the health department website, it can be the CDC website. And sometimes these things take a lot of work to get through, because I'll admit to you, I spend about 45 minutes a day going through the websites to see if there's an update. The message may change because, as Dr. Edwards Johnson said, the virus mutates. So sometimes what we say is what your body recognized last week. It's like a guy who shaves his head bald and shaves his beard and changes his clothes. Your immune system may not recognize the virus that has mutated. So we have to be prepared to change, but we still use those layers of protection, and vaccination is available. Paxilvid is available, and we still use our masks, and we think before we act or let someone in our house.
Thank you so much, Dr. Reynolds. Thank you, Dr. EJ. I hope this interaction and exchange has been good. I want to just remind our listeners that we do have some of our community credible voices in the background. We have representatives from the Genesee health systems for our mental health. We have Genesee Health Plan to talk about healthcare. I want to just mention out Joanne Herman, who's always out in the streets with the health department doing clinics. And so there are individuals here that are waiting to answer questions for you if you have them while we're on the webinar, so we can get those questions answered for you. And now, thank you, Dr. EJ, and affectionately Dr. EJ Jennifer Edwards Johnson, and Dr. Reynolds for sharing in that roundtable. And now our medical moment. We're going to have Dr. Susan Wolford come and share our medical moment. Dr. Wolford.
Good morning, Yvonne, or good afternoon, and thank you so much. We actually had a great segue into our medical moment today, because we are going to be discussing the vaccines and boosters, because I know that there is sort of a lot of information out there, and I thought it would be good to discuss what we can do at every age group to be sure that we are protected. And so, if we think about Pfizer, the numbers or some of the details are slightly different if we are thinking of Moderna, but we'll start with thinking about Pfizer. So we have to think about these vaccines at the moment in light of the primary series, then the first booster, and then the second booster. So if we're thinking about children who are 6 months old to 4 years of age, finally, yay, we have that primary series of vaccines for them. For Pfizer, it is 3 shots. So they get one, they get another one 3 weeks later, and then they get another one 2 months after that. And then they have finished their primary series. For Moderna, it's just 2 shots, 4 weeks apart, and they have finished that. Now, people might be wondering, well, what about those who are younger than 6 months? Do we need a vaccine for them? And we do vaccinate younger children for other things, but we hope in this circumstance that if mothers are vaccinated, that they will pass on immunity to their babies that will help protect them in that first 6 months. And of course, along with that, all the adults around them should be vaccinated so as to avoid the instances or decrease the instances when they'll be exposed to COVID and have to try to fight it off. So when they're 6 months to 4 years of age, That's all we have for them right now. Now, of course, it is very likely that boosters will be needed in the future. But right now, we just need to get them that primary series. Then if we go to our 5 to 17-year-olds, so both with Pfizer and Moderna, it's a 2-shot primary series. And then for Pfizer, a booster is recommended 5 months after they finish that primary series. So we know that young children are really not being vaccinated at the rates that we would hope. And so first of all, let's get them the primary series. But if you have a child who has already received their primary series, remember that they should then get a booster if it's been more than 5 months. If you're 18 to 49 years of age, you would have had, hopefully, your primary series, and you too would be eligible for a booster 5 months later. And then if you are 50 years or older, or if you're immunocompromised, then, well, for everybody, it would be the 2 primary shots. It would be a first booster, and you're now due for a second booster. So particularly as we think about going into the fall, we want to be sure that everybody is well protected, because as you heard on the roundtable, there is the issue of immunity waning. So I want to talk a little bit about that. And to discuss that, we're going to focus in a little bit on hairstyles. So if you try to think about my hairstyle here, I have natural bangs there, natural hair, and then side bangs, and here, no bangs, and then relaxed styles, and then throw a flower in for good measure, okay? So if you were trying to recognize me just by my hairstyle, it might be hard to tell it's the same person, because the styles easily are changed from one to another. And that's sort of what COVID does, because if we think about their spikes as its hairstyle, when it goes through making all of these variants, what it's really changing is that spike protein. Its hairstyle is what it's changing, not so much of the core virus itself. It is really mainly the changes that we're seeing in all of these variants, Omicron, Delta, et cetera, are changes in that spike for protein. And we could think about that as one could easily change its hairstyle. So if you only show it one hairstyle, like the natural bangs, if you then present with it with no bangs, maybe our body doesn't recognize it nearly as well. So we know that the spike protein is in fact changing its hairstyle pretty often from one to the other. And because it's changing that, it is making it harder for the vaccines that were created presenting one hairstyle to recognize it now when it comes along with another. And when we can't recognize it as easily, then our body can't fight it off as well. And then it has an easier time getting in, replicating, and doing all the damage that we know that COVID so readily does. So what we are looking forward to in the fall is having new vaccines that present more than one hairstyle. So Moderna already has data on their, as they say, call it bivalent. So it has 2 types of hairstyles presented, 2 types of spike protein presented to the body, so that then when the body is trained, it's trained to recognize both variants. Now, slight challenge with that, because how do you choose which hairstyle to use, how do you choose which variant to put in there, right? And you're sort of always behind the 8 ball because you don't know what hairstyle it's going to go to next. So you can only use one that it has presented beforehand. And so that's what both Moderna and Pfizer are doing, attempting to present 2 types of the spike protein in the vaccines that they hopefully will come out with this fall. So one might say to oneself, should we wait for that booster that has 2 types of the spike protein in there rather than, or the genetic information to teach our bodies how to make and fight those 2 types of spike protein? And the answer to that is most experts are saying no, don't wait. Because as was said, we don't know when surges will come. We don't know how long it will really take for these vaccines to come out. And so while if one were to wait, in the meanwhile, one could have come in contact with COVID and have a severe outcome, and that could have been avoided by getting the vaccines that are available now. So the recommendation is don't wait, get the one that's out there now. But there's good news on the horizon with the fact that there will be these bivalent, these ones that have more than one, or teaches us how to fight off more than one and how to recognize more than one spike protein. And further into the future, I just want to mention one other thing that is, it would be helpful to do. So whereas we can see here that the vaccines are attempting to teach us how to recognize just the spike protein, what if it could do more than that? What if rather than just seeing the hairstyle, you could actually see something more of the virus? So we could get something that is not just at the spike protein level, but more on the surface of the virus, parts of the face that doesn't change as much. So that if we could teach our bodies how to recognize parts of the virus beyond just the spike protein that changes so much, that we could recognize a part that doesn't change so much, like your nose, your eyes, your mouth, doesn't change very much. If it could recognize that, then maybe the immunity from a vaccine that could do that would last even longer. And so there are many who are working on that right now. And again, we can look forward to something of that nature being available in sometime in the future. I don't want to put a date on it because we all know that we have been woefully inadequate at our ability to do that. And finally, I will just want to say that we know that vaccines, this whole spectrum of illness with COVID goes from having no COVID to being infected with COVID, but having no symptoms, mild symptoms, moderate symptoms, severe symptoms, and death. And we know that the vaccines initially were protecting us all the way from mild, all the way through death. And still, even though they're hoping to make them better, they're still very good at protecting us against severe disease and death. And therefore, we should use that layer of protection that's available to us.
Thank you so much, Dr. Wolford. A lot of good information about vaccines and boosters. And hopefully this encourages us to help individuals understand why it's important to consider getting the vaccine and how the vaccine can protect. So a lot of, like you said, a lot of work still to go, but this is good information. So at least we know when we should get those vaccines. Thank you, Dr. Wolford. Since there's still so much to talk about and still so much information, one of the important things is how do we get access to this information? And today we're excited to be able to talk to you about an upcoming opportunity for us to use our little smartphones to get good information. So we have with us Athena McKay, who is Executive Director of Flint Innovative Solutions, who's working on some technology to help us figure out on our own how to get at some of this important information. Join me, Athena. Thank you so much for being here this afternoon.
Thank you so much, Yvonne, for the opportunity to present. It's, as Dr. Reynolds, Dr. EJ, and Dr. Woodford all mentioned, COVID has impacted us all, and it's ever changing. As you can see, I have my hair different. My bangs are natural this morning. Thank you for that analogy, Dr. Woodford. And Yvonne, you and HFRCC has been providing this critical information on a weekly basis. This is one of those sources of trusted information. What this app, and if my slides could come up, the GCCP, the Genesee County COVID portal, what we aim to do is to provide a centralized hub where those trusted sources are. As Dr. Reynolds mentioned, he's studying the CDC website for updates. We have the tremendous opportunity to, with our local health department led by Dr. Hacker, to have that information at our fingertips. But as we all know, technology is not always easy, even for us that are in this realm. But for those that are most impacted by COVID, Black and Brown community, we wanted to create this platform, an opportunity to be able to access this information, as you mentioned, Yvonne, at your fingertips. Next slide, please. So we are Flint Innovative Solutions. I have the opportunity of being the executive director. This app was developed by a local agency called Keeping Tabs. So again, you get those ideas. We're in community, we hear community voice, and we often sit at tables where this information is passed freely from us. But what about those people out in the community who work 9 to 5, who don't have the opportunity to hear this information and know that it's readily available? So again, this next slide, please. We were able to create, with the support of, actually, I'll give a huge shout out to Dr. Deborah Holton, who actually wrote this grant, which is the NNICE grant, managed by the Community Foundation of Greater Flint. The GCCP COVID portal, as you see here, this is the introduction video that will come on your home screen once the app is downloaded to your Android and or iPhone. We're also working on having it available through websites. And next slide, please. So we rely on credible health sources, not only HFRCC, not only our community experts, our doctors here, Dr. EJ, Dr. Reynolds, Dr. Susan, and others, you, Yvonne, and Dr. Hacker, and previously Dr. Deb. We want the sources available that you research. And so we had some community listening sessions, and we wanted to deliver this timely information to the community on an ongoing basis. We know that HFRCC has these long-standing commitment to serve the community, but what about 12 o'clock on a Wednesday when you're hearing you have some symptoms, or you know that you are taking a flight for a vacation? Where can I go get tested? This information will be readily available on your phone so that you can go to Genesee County Health Department's website. There's a direct link to those testing sites and also where vaccine clinics are available. Next slide, please. Again, it's a mobile app. It offers residents in Flint and Genesee County accurate information from prestigious institutions in healthcare and technology, such as our own MSU, again, the health department. And of course, I will be remiss if I did not say the Big Blue has a great source of information as well. Next slide, please. So I know I'm a visual person, and many of the folks in the community and our society now looks at visuals. So we wanted to make it appealing. This would be the homepage. And so you'll see this logo a lot. We're hoping for everyone to download this app. As you see in the middle of the screen, a link. All of these are hyperlinks. So once you click on it on your phone, you'll be able to go directly to the Genesee County Health Department, also the Michigan Department of Health and Human Services, or MDHHS, the CDC website, and Act Now is a collaboration between some medical institutions. And I will lift up Miss Lydia Stars, who I know has been on the webinar before. As a mom, she said, we definitely need to add some resources for parents. So that takes you to the pediatrics, the vaccine clinics, the testing sites. Go to our local area, which is from the Genesee County Health Department. Many of you know Flint Innovative Solutions host the Flint Eats app, which identifies food resources in the city of Flint. So there is a link there for healthy living tips, which include eating, exercise, and preventive measures. And then also we have data trends from FCHES, which is a unit from Michigan State University, which weekly share trends of COVID, whether it be unfortunate deaths, hospitalizations, infection rates. So that is all available through this one app that is launching tomorrow. Next slide, please. A quick, again, this is the homepage. If you notice at the bottom, all of those links in the middle are also available at the bottom. So once you go to the county website, the county link, you can always come back home to this page to maneuver back and forth through the app. We're going to give you a little snippet in the next slide of how it will appear on your phone. So in the middle, you see GCCP, you click on it. The motion animation will appear on your screen. You can click at the very top right as a link to our information of who we are for Innovative Solutions, our board, and our representation. These are the phenomenal people that I have the privilege of working with to get this information out to the community. Next, you'll see, once you click on the link to the county, which will again takes us to Genesee County Health Department, it goes directly to their COVID-19 information page, where you're able to access updates about the vaccines, where testing is available, etc. Next slide, please. Again, this is just a snippet. I'll, in about 3 more slides, I'll tell you when and how this information will be available to you. The resource hubs that we use, again, we talked about credible sources, and that's the ongoing theme of this webinar, and also the theme of the national, the NNICE grant. So this information is not Athena and her crew's thoughts and ideas and suggestions. These are credible sources that can be held accountable for the information that they provide to the community. We wanted to make sure that we were able to link to these trusted sources. And when I say trusted, we know that community does not always trust government, but they want to, right? They elect folks that they believe will be able to share that information that they can use for their families. So as Flint Innovative Solutions being a trusted source, we wanted to lift up the hard work that is done in our medical institutions and governmental officials. We have the Genesee County Health Department, again, MDHHS, CDC, the COVID Act Now website, Harvard's website, also Georgetown and Stanford. Next slide, please. And just to repeat, those hubs at the bottom is the American Academy of Pediatrics, Flint Innovative, Flint Eats, and then FCHES, which is the Flint Center of Health Equity Solutions, which is a National Institute for Minority Health and Health Disparities funded mechanism. Next slide. And that's it in a nutshell. It's the Genesee County COVID portal. Thank you for everyone in the community who offered input on what this app should look like. We are in the first version, so there's room for advancements, adding additional information, and making it accessible as possible to everyone. We are have had conversation with our partners to make this available in Spanish as well. So that should be on the horizon soon. And next slide. So when and where, right? Genesee County, the Community Foundation of Greater Flint has been a tremendous supporter of Flint Innovative Solutions. Hats off to Mr. Isaiah Oliver, who is always on the lookout for boots on the ground impact for our community. This project falls under the National Network to Innovate for COVID-19 and Adult Vaccine Equity, or NNICE funds. We are using these funds again to produce this app. And then tomorrow, actually, next slide, please. We are having this launch party at Ophelia Bonner Park. We ask everyone in the community to come out, bring your lawn chairs, bring your nieces, nephews, your cousins. Vaccines will be available thanks to our partners at Michigan United and Dr. Latressa Gordon. We'll have food, raffles, bounce houses for the babies. Vendors are welcome. We have a link on our website, on our Facebook page, if you are a vendor and want to share your educational information. The basketball court is open. There's a small air. We're going to do kickball, old-fashioned kickball instead of baseball, to make sure more folks can get involved. And again, the vaccines will be available on hand so that we can continue to combat COVID-19 and all of its many hairstyles, and making sure that this resource is available to the community. Next slide. Wanted to a second option to share more information, because the app will be launched tomorrow. On Sunday, we have an ongoing podcast. It's called Taking It to the Streets, Healthy Conversations for Us, by Us, COVID-19 and Beyond. This Sunday, the 5th episode will be, the topic will be community resources. So that's July 10th from 3:30 to 10:30 via Facebook and or YouTube, our YouTube page. Dr. Latressa Gordon, Nurse T, or Nurse Martin and Nurse Battle will be joining us. They are online panelists who will share resources. And we thank you so much, Yvonne and HFRCC, for allowing us to share this information. I appreciate the opportunity.
Thank you, Athena. You're very welcome. And again, this will be an ongoing opportunity for our community to get information about COVID at their fingertips. So thank you for that presentation, because this leads us, when we're talking about data, to another opportunity to hear some data from Dr. Alan Harris, who is a GIS analyst at MSU. So Alan, tell us a little bit about some of the upcoming data, so the data that you have unearthed for us today.
Right, so we just have the usual 5-week trend that we're looking at. As Dr. Edwards-Johnson and Dr. Reynolds talked about, there's always this lag that we need to stay conscious of. So those lag cases are in the dark gray. And when we have something like a holiday, it's good to pay attention to the lag numbers as they go on. We had like that little bump last week, but it's since gone down. So overall, the trend is it's continuing to fall in Genesee County and within the city of Flint. Testing positivity rate went up. That may be a product of just the overall testing going down. So maybe less people are testing, but we're getting more positives out of that total number of testing. Next slide, please. So we always try to keep in mind population density. So if we were to compare raw numbers, the city of Flint and city of Grand Blanc, and where there are more people, are always going to have those larger numbers, but we always divide it by their total population and then multiply it by 100,000. So you get cases per 100,000 people. So that normalizes the data, and so we can take a better look at understanding population density and how the virus is behaving. So Flint is right in the middle, as it's sort of been these last couple of months when we're comparing those total case rates from May to June. There was one increase, but that is probably going to be because Montrose Township is so small as far as total population. So even the smallest gain in numbers is going to look huge in those less dense. But City of Flint is still in the middle, as it sort of was last month. Next slide. And this is also a visual representation of numbers throughout the Genesee County, the municipalities of Genesee County. Again, so if you were to take, you just do the eye test where you say, where is the darker colors happening? That means there's more cases. That, yes, that's more raw cases, but these are all in the densely populated areas. So we're always taking a look, noting population density, noting disparities, and as we continue to get more data, we get data every week from the health department, process it, break it out by geography, break it out by time. So what each of these surges and each of these outbreaks sort of have these timestamps on them. So we try to dissect all that. And so we'll be continuing. Last week I did a comparison of age brackets. And so in the future, we want to continue to look at maybe gender and geography, and then probably some sort of combination.
Thank you so much, Alan. This is good for us to see just where these are in a visual way, so we can also know about how we can behave within our community in terms of how we actually reach out to others and interact in the community. So Genesee County Health Department, thank you, Alan. Genesee County Health Department is here today. Ashley Herbig, who is Emergency Preparedness Coordinator. She's been giving us updates on where we are in terms of cases and so forth within our community. So she's going to give us an update. Just Ashley, tell us a little bit about some of the things that are going on from the health department perspective that we need to pay attention to as a community.
So as the emergency preparedness coordinator, people equate me to basically the emergency manager on the public health level. So as my role in that position, there's a lot of things that I monitor right now. The top hitters, obviously COVID-19. I'm also monitoring our status for monkeypox, avian flu, triple E or Eastern equine encephalitis, West Nile, and then the Flint River oil spill. So these are all things that I'm remaining cognizant of. We get updates weekly from the state, and then we also work with community partners. So for the oil spill, I work with the emergency management, Homeland Security, just to make sure that everybody is on the same page and we're communicating all the information to each other. COVID-19 is still prevalent, still a pandemic. As far as like a region is concerned, we are considered region 3. So if you go to MDHHS and you look for outbreak statuses, region 3 as a whole, which encompasses 13 counties, has 3 new long-term care facility outbreaks, but we are reporting 48 ongoing outbreaks. So that's something to keep in mind as we move forward. When it comes to COVID-19, it does take the front seat for a lot of conversations for obvious reasons, because it is a pandemic. And because, we are in that in-between surge, are we, aren't we, where are we going, vaccination, what are we doing? So that's something that we try to stay mindful of. We also, when it comes to monkeypox, we do have 1 probable case in Michigan, located in Oakland County, as of June 29th. So that is something that I am, amongst our communicable disease team, we're remaining mindful of. There is a 2 p.m. call today with an update regarding that. So I've got plans after this call. And then as far as bird flu is concerned, for community awareness, as of June 13th, we have had no new cases for 30 days, which means that they rescind their stop of all of poultry and waterfowl exhibitions. So we are now allowed to do poultry and waterfowl exhibitions. And we are kind of in that quiet phase for bird flu. We are in mosquito season, which is usually late March, early November. So that's where we take into consideration for Eastern equine encephalitis and West Nile virus, all transmitted by mosquito bites. Obviously, our prevention measures there is don't get a mosquito bite, but we all know you walk outside for a minute, it's going to happen at some point. So just being mindful of signs and symptoms and knowing, your surroundings, what season you're in, just being careful. And then the oil spill is still ongoing. We are still working on that. Boots are still on the ground. The public health order still stands. There is a no contact order for the Flint River from Stepping Stone Falls to Leith Street, with no consumption of fish from the Flint River from Stepping Stone Falls to Willard Road. These are all remaining in effect. That health order will still stand until all relative and participating organizations agree upon an all clear. So if you see signs by the Flint River, we went out there and put those all out there, and we mean for them to be there. So please don't take them down. Please don't fish, don't consume the fish until an all clear is given.
Ashley, just quickly while you're right there, there was a question, I think you covered it, but I want to make sure if you could address whether there are some of the diseases that you mentioned, monkeypox, bird flu, are any of those diseases in Flint, Genesee County?
Not at this time, no.
Okay.
Monkeypox, there's one probable case in Oakland County. I believe there's going to be an update on that case, confirmed or not, on the 2 p.m. call. Bird flu, there have been no domestic flocks in Genesee County, and we have no reported Triple E or West Nile in Genesee County at this time.
Thank you. So where are we in terms of COVID and our clinics and et cetera that we want to make sure everybody's up to date on?
Absolutely. So our 3 standing locations for our clinics are still in rotation. So that's Our Lady of Guadalupe, Shiloh Missionary Baptist Church, and Central Church of the Nazarene, all on a rotating schedule. We do have 5 pop-up clinics at this time on the books for July with our partners at Michigan United. One has been confirmed. Athena did touch on that at Bonner Park. So information for that will be sent out. The other ones, we will send out information to the public as soon as possible. We are waiting for our locations to confirm the date and time before we start blasting it on the media. The vaccination sites, they are 6 months and up for Pfizer, 6 months to 5 for Moderna, and then 18 and up. There is that distinction, first, second, third, and first booster, second booster. Whatever you need, whatever your vaccine needs are, if you are concerned about anything at all, we are all very knowledgeable at the sites. We are all very happy to help you. So please, if you have any questions at all, any hesitancy or anything that you want to just get off your chest at the vaccine site, before you get vaccinated, by all means, always ask. We're always happy to help and ease your mind and give you the information you need to make the choice that's best for you. We do have our MDHHS Quanu testing sites. These are our Word of Life Church, Bethel United Methodist, and Macedonia Baptist Church. These are going to be testing sites that are partnered with HANU and MDHHS. So they offer rapid antigen testing as well as PCR testing. PCR testing is available upon request. So keep that in mind. If you go in for a PCR, you do have to ask for it. We do have other testing and vaccination sites. These 3, Walgreens, Hamilton, and Rite Aid, a handful of them are listed as drive-up testing sites. That's going to be updated on Monday just to confirm that, as we continue with COVID, the whole pandemic has been very fluid with changes happening, even as we speak of it. So continuous updates and making sure that we have testing location information available at all times is going to be our key to success here. And as always, additional support is always there for you from the Genesee County Health Department. We have information available in English and in Spanish. We do have a call center. If anybody needs any additional information, have any questions or concerns, you are always welcome to call 810-344-4800. All of our information, resources, educational materials can be found on our website at gchd.us. But if you are having difficulties navigating through the website, have any barriers to access to the website whatsoever, please give us a call. If for some reason you have access to do so, then let's leave that phone line open for those that are unable to use the resources.
Thank you so much, Ashley. We appreciate
Absolutely.
your update today and that insight about other things that are happening in our community, so
Yes.
we can know what to look out for and why that's important, and to know that you're out there helping make a difference. Thank you so much.
Absolutely. Thank you.
Just to give a quick update from the city, Kiana gave us a call that she was not able to be with us today, but there are two critical things. We talked a little bit about this previous week, that the Racer Trust was going to do a public information session that has been scheduled for this Thursday, July 14th, from 6:30 to 8 p.m. They're going to be talking about what's happening on the Buick City site and some other environmental issues that they're working on. You can join by Zoom. She wanted me to really reiterate, this will be a Zoom call. And it will be live streamed through Spectacle TV. So if you are interested, please go on and register to be a part of this event so that you can get the updates from this public meeting. Again, it's Buick City Environmental Public Information Meeting, Thursday, July 14th from 6:30 to 8:30. 6:30 to 8 p.m. And you can get this also by calling. If you have any questions, you can call 518-480-7993. This is from the city of Flint. The other information they wanted us to share with you today, that the Flint Flat Lot Day Fest is going to go on. It will be an event on July 10th, that Sunday. These are each Sunday. So Sunday, July 10th from 2 to 6 p.m. You want to join the city of Flint on the flat lot to have a day of festivities. Again, that will be Sunday. As we prepare to close today, I really want to also let you know that the Healthy Flint Research Coordinating Center is in the process of preparing for its third annual symposium, so 2022 research symposium. We're talking about the long road ahead. So we want you to save this date. It will be in September. It's Friday, September 30th from 9 a.m. to 3 p.m. It will be live this year, downtown Flint. We'll give you more information on that. But if you are interested in submitting an abstract, please submit that abstract. They are due on July 18th by 5 p.m. If you have information or research or work that you've done in the city of Flint, maybe you have been with some community partners, please submit. You may have done some work that you want us to know about, because we'll be showcasing this work for you. So please submit those abstracts. They are due by July 18th. You can go on the Healthy Flint Research Coordinating Center's website and get that information there. So we look forward to you being a part of this event. Again, mark your calendars, September 30th for the 2022 Research Symposium, the long road ahead. We're talking about building capacity and building partnerships. And so today we want to just remind our social workers and our community health workers to continue to apply for those continuing education units, as well as your contact hours for social workers. Stay on immediately following the webinar today so you can get that information in. Submit your evaluation so that you can get those credits that are available to you. I want to just invite quickly, Dr. Reynolds, can you come back on the screen for us for just a quick minute? Dr. Reynolds and Athena, Dr. Wolford, just to say to you today, we had a couple minutes to come back on the screen and let us say thank you, Dr. Wolford, for that medical moment. Athena, thank you so much for sharing that information about the app that's going to come up, because that's a very important and useful tool for our community. And of course, we want to thank Dr. Reynolds for always giving us those words of encouragement. These are our local credible voices. There are some others that are on the screen. Katie Baxter, I want to give a shout out to you today too. Katie Baxter is from the Genesee Health System, who is always there to give you information about our mental health and others. So just want to thank you all today for joining us for this webinar, and ask you to stay tuned, because we've got great information. Next week, we're going to be talking about how COVID and long haul. This is something that has been a question for many, long haul and COVID. So if you're listening today, we want to invite you to encourage other people to join us next Friday to get some information on COVID long haul. It's been a question for many, many weeks now. We've learned more and we can share more. So thank you all for tuning in today for the Flint Community Webinar on coronavirus. Appreciate you all for being a part of this event today. And we want you to continue to like us on Facebook, subscribe to our YouTube channel, Healthy Flint, or you can always send us an email with any questions that you might have at info@hfrcc.org, or give us a call at 810-835-2130. We ask you to join us next week for session 122. And I appreciate those questions that continue to come in and give us some guidance on things that you're interested in talking about. So join us next week for the Flint Community Webinar on coronavirus. We thank you today for joining in, and we look forward to seeing you next week.